vasodilators are the drugs that dilate the blood vessels by directly acting on the smooth muscle cells through the non-autonomic mechanisms, and they are very useful in treating many hypertensive patients. There are four mechanisms by which the vasodilators act, and these include the blockade of calcium channels, the release of nitric oxide, which is a very potent vasodilator, the opening of potassium channels, which kind of stabilizes the membrane and prevents the contraction, and the activation of dopamine receptors, which causes a vasodilation in the vessels. Let's start with the calcium channel blockers. These are very efficacious, and in addition to their anti-anginal and antiarrhythmic drugs properties, calcium channel blockers, they also reduce the peripheral resistance and blood pressure. The mechanism of action by which the calcium channel blockers work is that they inhibit the calcium influx into the cell, and as a result the contraction that is mediated by calcium is prevented. What we see is that decreased in the contraction in the smooth muscles of the vessels as well as in of the heart. There are two major divisions of the calcium channel blockers. Number one is the non-dihydropyridines, which are composed of two drugs, verapamil and diltiazem, and the second is dihydropyridines, which includes nifedipine, amlodipine, nicardipine, estradipine, felodipine, and clevidipine. Now, the non-dihydropyridines, which includes verapamil and diltiazem, they are cardioselective, which means that they blocks the calcium channels in the heart, and a result is that there is decreased cardiac output, and this actually results in the lowering of blood pressure. However, the dihydropyridine drug, it blocks the calcium channels in the vessels. It is more vessel selective. It blocks the calcium channels in the vessels and causes a decrease in the vascular resistance, causing vasodilation. And this vasodilation is basically responsible for the antihypertensive effect of the dihydropyridines. The cardiac depressant effect of the verapamil and diltiazem is very great as compared to the non-dihydropyridines, and we have and among these, verapamil has the greatest depressant effect on the heart, and it also decreases the heart rate and the cardiac output. Some epidemiological studies, they have reported an increased risk of MI with short-acting nifedipine for hypertension, and it is therefore that short-acting oral dihydropyridines should not be used for hypertension because they do not sustain the levels of blood in the levels of drug in the blood that is required to maintain an antihypertensive effect. We have nicardipine and clevidipine, and both of these drugs are available in the IV formulation. In the non-dihydropyridines, verapamil and diltiazem both are available in IV as well oral formulations. Toxicity of calcium channel blockers is that it can worsen the edema in patients who are already prone to edema. And so we need to monitor the patients who are taking calcium channel blockers for this adverse effect. Moving on, we have the other vasodilator, hydralazine. Hydralazine is a hydrazine derivative. It dilates arterioles and not veins, which means that it acts on the arterioles and does not affect the veins. And the hydralazine, the combination of hydralazine and nitrates is very effective in heart failure, and they can be considered in patients with both hypertension and heart failure as well. The mechanism of hydralazine vasodilation is by it causes release of nitric oxide from the endothelial cells. Now, this is the nitric oxide is a very potent vasodilator, and what it does that it causes the guanylyl cyclase, which is an enzyme that produces CGMP. This CGMP causes the protein kinase to inhibit the entry of calcium influx, thereby preventing the contraction that is mediated by the calcium. So the net result is vasodilation. So this vasodilation, it causes a decrease in the peripheral vascular resistance. It decreases the resistance in the vessels, and it causes a decrease in the blood pressure. So this is how hydralazine is used as an antihypertensive drug. As far as the pharmacokinetics is concerned, it is very well absorbed and it is rapidly metabolized by the liver. However, the bioavailability is low. It is around 25%, and the half-life of hydralazine, it ranges from 1.5 to 3 hours, which means it has to be given 2 to 3 times in the day. The higher dosages were selected at a dose at which there is a very small possibility of developing the lupus erythematosus like syndrome, which is a very common or a well-known adverse effect of the hydralazine. The toxicity of hydralazine includes headache, anorexia, sweating, nausea, palpitations, flushing, and lupus erythematosus. It has been a fever that resembles lupus erythematosus, which includes arthralgia, myalgia, skin rash, and fever. It has been associated with the use of hydralazine. However, the syndrome is not associated with renal damage and is reversed by the discontinuation of the hydralazine. Peripheral neuropathy and drug fever are other serious but uncommon adverse effects of the hydralazine. The next drug in the category of vasodilators is minoxidil. It is a very efficacious oral active vasodilator. The mechanism of action of minoxidil includes that it causes the opening of potassium channels in the smooth muscles, and which basically stabilizes the membrane at its resting potential and make contraction less likely. So this is a diagram in which the potassium channels, they are open, potassium comes out, and it prevents the influx of calcium inside the cell, and thereby it prevents the contraction. So the overall effect that is seen is the relaxation of the smooth muscle. So this is the mechanism by which minoxidil works. The relaxation of smooth muscles will cause a decrease in the peripheral vascular resistance, and there will be a net decrease in the blood pressure. As far as the pharmacokinetics is concerned, the minoxidil that is taken orally can also be given as an IV infusion in hypertensive emergencies. It is an excellent antihypertensive drug, and the use of minoxidil, it is also associated with reflex sympathetic stimulation and sodium and fluid retention. So it must be used in combination with beta blocker. Otherwise, the antihypertensive effect will be of no use if there is no combination of a beta blocker or a diuretic. This drug is no longer used as an antihypertensive drug because of its toxicity profile, and is the toxicity profile includes tachycardia, angina, palpitations, edema, and hypertrichosis. And this phenomena is particularly bothersome in women and is relatively very common. However, it illustrates how one person's toxicity may become another person's therapy. Topical minoxidil is used as a stimulant for hair growth for the correction of the baldness. The next drug is nitroprusside. It is a very powerful parenterally administered vasodilator that is used in the treatment of hypertensive emergencies. It is used as an continuous infusion. Nitroprusside dilates both arterial and venous vessels, which results in a reduced peripheral vascular resistance, and it is a complex of iron and cyanide groups. It is rapidly metabolized into the red blood cells and causes a release of the nitric oxide. And this nitric oxide, it acts in the smooth muscles of the vessels and causes vasodilation. And this is how it decreases the peripheral vascular resistance and a decrease in the blood pressure. The toxicity of includes the accumulation of cyanide, excessive metabolic acidosis, arrhythmia, or hypertension. Death has also been reported with the use of sodium nitroprusside. The toxicity of the accumulation of cyanide can be prevented by the administration of the antidotes, which are hydroxycobalamin. And there is another antidote which is called as sodium thiocyanide, thiosulfate, and both these are administered as a prophylactic agent during the administration of nitroprusside in order to prevent the cyanide poisoning. The next drug is diazoxide. It is a very effective and relatively longer acting peripherally administered arteriolar dilator. It does not have any effect on veins and it causes the dilation of arterioles. The mechanism involves the opening of potassium channels, which causes the membrane stabilization. And this membrane stabilization actually leads to the vasodilation. It prevents the contraction and causes the vasodilation. The vasodilation in turn causes a decrease in the blood pressure. This is how the isoxide work. It is chemically very similar to thiazide diuretics, but it has no diuretic activity. It is bound to serum albumin and to vascular issues. It has a very long half-life, which lasts for about 24 hours. The blood pressure lowering effect that has a very after rapid injection is established within 5 minutes and it lasts for around 4 to 12 hours. The toxicity of diazoxide includes excessive hypotension, and as a result of this hypertension, stroke and myocardial infarction can occur. It also, a very unique characteristic of the diazoxide is that it inhibits the insulin release from the pancreas. Therefore, it is used in the treatment of hypoglycemia that is secondary to insulinomas. The next drug is phenolopam. It is a peripheral arterial dilator that is used for hypertensive emergencies. It is an agonist of P1 receptors, which are present in the vessels, and it causes the peripheral arteriolar vasodilation. It is rapidly metabolized and primarily by conjugation. The half-life of phenolopam is very short. It is around 10 minutes. The drug is administered by continuous infusion. And as with other vasodilators, the major toxicities are reflex tachycardia, headache, and flushing. It also increases the intraocular pressure and it should be avoided in the patients with glaucoma. So this was all about the vasodilators.